Welcome to my presentation about minimally invasive surgery, spine surgery to be precise. This presentation is going to be done like my Greek presentations, which means we're going to talk about the literature on the subject. We're going to see what's going on. We're going to see what the studies show, and we're going to make recommendations for every one of you that suffers from sciatica or other spine problems, related spine problems. So the theme of this presentation is minimally invasive surgery the thing? Will it make a difference? Will it make patients better? Is it really better? Is it important, firstly? Is it more effective? Is it more safe? That's what we're going to see now. So, what is a minimally invasive spine surgery? Because usually, when you're a patient, they tell you we're going to do minimally invasive spine surgery, but it's not clear what exactly this means. The one main philosophy of minimally invasive surgery is to do minimal damage, do as less damage as possible to the patient's body. So that's why we use tubes and a microscope. These tubes are quite small, actually. They're like 12 or 14 millimeters, or something, maybe about a centimeter or something. And these tubes allow us to have minimal damage because we actually cause damage to the tissues that have the volume of this tube, and we can reach our surgical target and do what we have to do without causing more damage. And we can actually be more precise when we operate, because usually in traditional surgery you have to remove so much bone, but now you just remove the bone you have to remove. It's so little bone that sometimes you can't see it when you do an exam after surgery. So tube surgery and endoscopic surgery. Endoscopic surgery is not exactly minimally invasive for many colleagues, because some people say it's a different thing to do endoscopic, a different thing to do minimally invasive. The truth is that endoscopic surgery is a type of minimally invasive surgery. You don't use a microscope, you use an endoscope that goes inside, not through a tube, it just goes through the skin and through the tissues to reach your surgical goal. Endoscopic surgery is something a bit different. It has some differences we're going to see later when we see the literature. So, the advantages of minimally invasive surgery, we got really many advantages here. First of all, we have an equal effect, which means that minimally invasive surgery is not worse than traditional surgery. This is really important because many people say that, when we do minimally invasive, it's less invasive, so it does less stuff. That's not the case. You have equal effect. Complications are less because you damage less tissues. That's normal, right? If you damage the tenth of the tissues that you damage with traditional surgery, you're going to have less damage, you're going to have less complications. Recovery is faster because the patient doesn't feel so much pain. There are exceptions, but the average patient is much better. We have less contradictions because since we do less damage, it's less invasive, so we have less contradictions. There are fewer patients that we can't do this thing. Less hospitalization. Well, this is the case with traditional surgery also, because many cases operated with the traditional way can just leave the same day from the hospital, but still, less hospitalization means that actually the patient only needs a couple of hours to stay in the hospital. Usually we keep them for billing reasons or other reasons, but they could really leave after a few hours. With traditional surgery, they definitely need more hours in the hospital. Less blood loss, really important. Less damage means less vessel damage. You destroy less vessels, and this means you have less blood loss. It's normal, right? And the other thing, when you have a trauma in a big vessel or a medium-sized vessel when you're doing the operation, because there's not a lot of space, usually the blood doesn't have to go. It can't go anywhere else, so it stays there, and the bleeding stops much faster than traditional surgery. Less infections, that's because we do less damage, so it's normal to do less infections, to have less infections. And it's less expensive. That's really strange because to do minimally invasive surgery, we need special tools, special equipment, which usually cost. But since the patient stays less in the hospital, the total cost is much less. And since we have less complications, the total cost is less. So, any disadvantages? Of course, with everything we do, there are advantages and disadvantages. And minimally invasive surgery is unsuitable for some cases. There are some cases where we need more exposure, so it's not possible to do the traditional minimally invasive surgery, and we have to do a larger incision to closer to traditional surgery. It's definitely more technically demanding. This is really important because Being technically demanding, what does it mean? You have to, it's more hard for the surgeon to reach his surgical goal because you have to be so precise. And this actually creates some problems. Sometimes you have to spend more time during the operation, so increased operation time. This is not the case in some studies we're going to see when we see the literature. And the learning curve is definitely steeper. It's more difficult for a surgeon to learn the method. So this means that there's a great possibility that our surgeon probably doesn't have enough experience with the method, and maybe his results are worse than they could be. Because if you see, there's no organized fellowship currently training surgeons for minimally invasive surgery. Usually we see minimally invasive surgery for spinal fusion, but most fellowships don't specifically train you to do a decompression with minimally invasive surgery. So there's not enough experience out there. That's true. So what should I choose if I'm a patient? Should I do minimally invasive? Should I do traditional? What should I do? Most surgeons would opt for minimally invasive. I mean, most of you that maybe went to a spine surgeon, 99% of the time he told you, I'm doing minimally invasive. This is the state of the art. You gotta do this. Don't do traditional surgery like some people do. So yes, that's true. It's good to do minimally invasive if it's applicable. It's definitely superior to traditional surgery, but sometimes we need to do different approaches. So we have to be very careful when we examine a specific case. To be more specific, when you have scoliosis, sometimes traditional surgery is better. And when we have cervical approaches, we get neck surgery, actually for the cervical spine, usually traditional surgery is equal, maybe sometimes even better than endoscopic surgery or minimally invasive surgery. So let's see the literature. In every presentation, I like to see the literature with my viewers. It's quite tiresome, but it's good to see that there are papers, there are articles, there are manuscripts that actually help people to make decisions. So let's start seeing the literature together. Now, here we see systematic reviews and meta-analysis, and we try to see a large sum of data to see what it does.